remaining VIPs. And we have, let's see, Ms. Zip.
Yeah, Sue is my name.
Yeah. How's baby? You missed the daughter?
Alyssa, yeah, she had to go. She felt really bad
Yeah.
that she couldn't be here today, but they had to go home yesterday. My grandson has school.
Sure.
And, but she's so thrilled with everything. I mean, she's the main reason, too, why I decided to have it done, because I see how she's done so beautifully. I mean,
her daughter had surgery back in May?
April.
April, right? Thank you.
And she's lost now 88 pounds, and she's feeling and looking wonderful. 5 months, yeah. And she eats anything she wants, just a little bit of it, which I find so great, because, you know, without that, I don't think I could have been successful. So this way, at least you can eat a little bit of what it is that you need.
Right.
But I had my operation on Wednesday. Last Wednesday, I think it was 36 minutes. I did have 2 drains. Now I have one. One drain fell out. I see these 2 women were not bruised, but my stomach is really bruised.
Now, think about that. You said a couple of things together, and I'm going to go back over them and tell you that they're actually related. You said that you have a drain,
right,
and you're very bruised.
right.
Do you know why you have a drain? Because you had more bleeding than the other patients, and so it's not surprising you've got a bruise. So maybe during the time of surgery I was wise enough to recognize your increased risk of bleeding, and I put in those drains.
Right.
Because if you have blood in your abdomen, it hurts. If you think of when God created us, He gave us the sensation of pain, right? Presumably it wasn't a cruel joke. It was a good idea, so that if you step on a tack or if you put your hand on the stove, you get the sensation of pain and you get warning, move, change, do something. Well, we know that you had surgery, and so the blood in your abdomen giving you the sensation of pain doesn't help us do anything better. So we put those drains in to let some of the bloody fluid come out, and that gives you less pain. And so your abdominal bruising is consistent with what we found at the time of surgery. You were having a little more bleeding than average, so we give you those kind of annoying drains. And they're kind of a pain, they're kind of annoying, but they're nothing compared to the sensation of pain of blood in the abdomen. That hurts. It's no fun. And constantly having that signal of pain is very unpleasant. So when we choose the lesser of 2 evils, we think that those drains, annoying as they are a better choice. Good.
Yeah, they are annoying, but
Right.
I'll be happy to get this one out. The only other thing, I guess, well, I did have diabetes.
I beg your pardon?
I did have diabetes because my sugar, without taking, I haven't taken any diabetic medication since the operation. And it's been wonderful. It's been lower than when I was on medication for my diabetes.
Wow.
So the readings have been great. I'm really happy about that. As far as my high blood pressure, that's kind of like a little up and down, kind of wait and see, I guess.
Well, pre-op, what blood pressure medicines did you take?
I took 2 pills a day.
Right, the atenolol?
The atenolol and the Nidafit.
Right. And now you're taking an occasional atenolol.
Right.
She used to take 14 pills a week. This week she had 2 pills.
Right. So we're getting better. Sometimes it takes us more than a week to cure everything. Sometimes 2.
That's too bad.
Yeah, right. But if you think about it, you're improving, and just like your weight loss, you've seen your daughter improve in her weight loss day after day after day. If your daughter came to you the first week after surgery and said, oh my goodness, this is not very good surgery because I haven't lost 88 pounds in the first week, you go, you know, it's going to come. And so we feel, of course, your brother and I have talked on the phone about this, we feel that everything's on target, but you arrived here with a lot of baggage. You know, as we say in our business, I'm giving away a lot of our special doctor cliches this morning. So one of them is, they would say, you are an SOL.
Okay.
That's a sick old lady.
Sick old lady. Can I be an ex-SOL?
That's right. You're going to be a former
Okay.
SOL. That's right. And so we're excited about the diabetes getting better. We do think that it's not surprising that your diabetes may not be completely gone today, you know, 6 days post-op.
Right.
Sometimes it takes a few extra days, and that's all right. Nothing wrong with that. Your blood pressure also, remember that our cure rate for blood pressure and diabetes isn't 100%. So, you know, with your age and other medical illnesses, there's not a guarantee both will be cured.
Right.
It's possible you'll need some blood pressure medicine or a little taste of diabetes medicines forever afterwards, but very unlikely. It's possible, but unlikely. Our cure rate of diabetes is something in the range of 98%, but not in the first week. And high blood pressure, similarly, 85 to 90%, because there are some thin people who have high blood pressure. So we might make you a new thin person as beautiful and successful as your daughter and still have high blood pressure. But again, the chances are we're going to take care of it.
I would think so, because my high blood pressure came as I got heavier and
Right.
heavier and heavier.
Right.
And then at one point I had lost 100 pounds.
Yes.
And I went off my
Blood
blood
pressure.
pressure medication. But as soon as I started gaining weight again, it came back.
Well, as they say, this is Las Vegas where there's lots of betting going on. I'm willing to bet. I think you and I have a quarter bet, don't we? Or a
Yeah.
nickel? Don't we have a nickel bet?
Yeah, well, I'd like to lower that to a nickel.
Okay, all right.
Penny.
All right, good. Well, I had one patient one time, and I said, you know, sometimes our patients' monthly menstrual cycle unpleasantness gets better after the surgery because our estrogen levels in our patients goes down. And she was a very strong-willed individual, and in a very blunt way, she said, "No way!" I said, well, no, I think there's a possibility, I don't know for sure, but there's a possibility that, you know, the terrible, unpleasant monthly time when your cycle goes through, she says, you don't understand. When I have my monthly cycle, we close the blinds, everybody gets out of the house, and I take all this medicine, I take Furus, you know. And I said, well, I'd be willing to actually bet you a quarter that that's going to get better. Oh, you're right. And about 2 months later, I got an envelope and opened it up, and there was a postcard with a quarter taped to it. Yes, I make a fortune in betting here in Vegas. What about questions that we have to go through? Anything that we have to ask about?
Well, related to the procedure, you just wanted to know about having the drain out, and
Well, yeah, well, I know.
we did want to talk about a note for the doctor. But before you do, I'd just like to say that you know, she took a handful of pills for cholesterol, high blood pressure, diabetes, and all kinds of things for a number of years, and I've monitored all those things except for cholesterol, of course, and all those numbers are just going way down. And she's on no medicine. I mean, 2 blood pressure pills in a week.
I did have some time, well, I spent an extra day in the hospital instead of 1. I was there for 2. I wasn't strong, I didn't feel strong enough to go home the first day. And I don't like pain medicine, so the pain medicine made me feel kind of, I mean, I was seeing things on the wall. I don't like that.
Should have given it to me.
So the extra day helped. I did have some pain, but pain now is very minimal. The worst thing is the drain right now. That's the pain. I did have some dry heaves. Nothing would come up, which was good, but I did sometimes have dry heaves, and I took that Regolin, which helped. It made me very sleepy, but it did help.
Right.
And other than that, walking, it took me a couple of days before I could walk more than a little bit around the house. Like yesterday was my biggest day on walking. I went to the store, we walked around, I went to a casino, we walked around.
And a little perspective is, she couldn't do that before the operation.
Yeah, that's what I said. That's right where I was going to go. Okay, in other words, a lot of people say, you know, boy, it's rough after the surgery. You know, I couldn't walk up a flight of stairs, you know, and it really took me a lot of work, you know, gradually to build up to walking up 2 flights of stairs. And I said, well, how many flights of stairs could you walk up before surgery? Oh, I couldn't walk up.
That's true. I had to keep remembering that,
Yeah.
that, you know, I couldn't do it before surgery, so
Yeah.
it's going to take a little while. But now I feel really good.
And again, if you think about it in perspective, it can take several days to get over the surgery, you know.
Yeah,
I mean,
sure.
yeah. And also, remember, you, again, like we talked about, you're not 25. You didn't arrive here in excellent physical condition. So I'll tell you another story. One of our patients was talking on the internet mailing list, you know, that mailing list where we send things back and forth. And so he was from Florida. He had surgery with Dr. Paragli in Florida, and he got on the mailing list saying, I don't know what's wrong. I'm really worried. I have big problems. My legs are killing me. They hurt and hurt and hurt. And I didn't really answer to that because, you know, he wasn't my patient. I was just listening and watching the emails. And then he came back on, I'm really worried, and then I'm worried again. And some people said, well, maybe you should call your doctor. And he said, I'm worried, I have terrible pain. He says, oh, then he came back on, he wrote an email. He said, I figured it out. My wife and my physical trainer have explained to me I don't have enough protein, and I'm low on protein. So then I had to I said, please call me, you know, let's talk, because low protein is unusual in our patients, except for Felice. So I said, you know, now wait a minute, now tell me what's going on. He said, well, I have terrible, terrible pain. I said, okay, let's see. When does it happen? He said, well, I'm retired, and I live in a retirement community in Florida, and when I'm walking back from the gym that we have, my legs hurt. I said, okay, what do you do at the gym? I said, your legs don't hurt on the way to the gym. He said, no. I said, when you come back. I said, what do you do in the gym? He said, well, I bicycle on the bike for 25 to 45 minutes, and then I lift weights and, you know, do squats and all that stuff. And I said, okay, well, what did you do before surgery? Well, not much. I said, well, when was the last time you were in the gym prior to surgery? And he says, I think it's 1965 when I was in the gym. All right, so your legs hurt after you go to the gym and you exercise. He goes, yeah, oh, I see where you're going with this. All right, and you haven't been in condition, you haven't been in shape since 40 years ago. He goes, well, that's about right. And so. Other questions?
Nothing right now. I'm just glad I'm past that.
Yeah, that first couple days can be rough. And it's kind of scary, you know, you're not sure how things are going to go.
Right.
And that's one of the things that's somewhat good but somewhat bad about having me as your doctor. And what I mean by that is I have landed this jet airplane 4,000 times. Right. So I'm pretty at ease. So when you all looked at me, I could see that kind of anxiety in your face, but the things you were telling me didn't bother me. I felt pretty at ease.
Right, and that, with calling you every day and telling you our concerns, and you saying, that's fine, relieved my anxiety.
I do have to be careful, because sometimes I'm so flippant about your issues that it can come across negatively, and I hope I did not come across that way.
No, not at all. It made me feel better to know that to you it was nothing. To me it was...
But I could see that you guys were very nervous about things, but I felt like that this was a routine flight.
Right.
And we were going to bring it in for a safe landing, and looking at you today, I feel pretty confident about that.
Yeah, things are going very well. I was very happy.
You could see her getting better hour by hour.
Right. Right. But I remember that first morning going, well, I don't know about this.
I'm kind of squeamish myself.
Well, and that's understandable. Again, the advantage of this, of coming all this way and having surgery with me is, you know, I land this jet most every day.
Right.
So.
And that's why I gave to you.
Right. Good.
I don't know if this really has anything to do well, it doesn't have anything to do with the surgery, but we were on the email list and everything, and we found out where to stay at the Sienna Suites. Well, last night, I mean, the element there must be going downhill.
Oh,
I would
really?
never recommend that.
Okay.
They had a big shootout.
No way!
At 2 a.m. in the morning. I mean, I never heard a gunshot.
They provoked me, okay? They provoked me.
That's not the best place. There's a lot of, I mean, this is Las Vegas. There's thousands of hotels. You can
But
go
see,
on
a
the
lot of
internet
people
and find incredible deals.
Yeah, a lot of people have been recommending it.
recommended it, and
Yeah,
and
we
they
need
said
to-
it was a good price, nice place.
Well, you can stay at
I don't
the
know.
Fiesta Casino for $49 a month right down the street, or the Holiday Inn Express for...
Excuse me, a month?
A night. You can stay at the Holiday Inn Express and the Hampton Inns, which is right in the middle of a lot of shopping.
But I think we need to put out that information
I will.
on the
I'm gonna
email
put it
list.
on the
Yeah,
email.
yeah, because I did not know that.
No, I
Expected to
didn't
see it
either.
on the news, and they didn't even put it on the
They didn't
news.
put it
No, it's just
There were
another
60
gun.
police cars.
Yes.
They
We
were
do that in Las Vegas.
evacuating the buildings. Oh, God. It was frightening.
Where is
I
it
slept through it.
Where is it?
He slept through it. Yeah, he did.
Where are those?
The Sienna Suites?
Yeah.
Down Boulder Highway.
Well, hello, that's why.
Oh, Oh, really? Well, everybody recommended it. So
We did. We've had a lot of people recommend it. Yeah.
We also had a lady recommend a bed and breakfast, and I went to pick up one of our patients, and I was like, oh wow, I don't even want to drive on this side of town.
Okay. Well,
Well, when you're unfamiliar with the area and somebody says...
Well, that really helps us because I had never heard of it, and I can tell you, I've heard at least 20 times people thought it was wonderful.
Right, that's why we went there.
Right,
I heard that
right.
too. I said, well, I'm going to post, it's not so wonderful.
Not so wonderful, yeah.
The thing about it is, it wasn't unusual. You could tell by what was happening at night there that something was brewing.
You know, if you're paying that little of money, it's not going to be in the best neighborhood.
No.
I mean,
Okay, well, we'll let everybody know that. Anybody here staying at this inn?
are you?
It's very exciting at night.
Well,
Yeah, I read that it was really good, and one of the main reasons we decided to stay there was because of the recommendations, and also because it has a fridge and a microwave.
Right,
and
there's
some of the other ones
sweet
did not.
ones.
Yeah, if you stay at the
Well-
Fiesta, you can request, any hotel you can request a refrigerator and a microwave. You can stay at like the Holiday Inn Express, the only reason I say that is because it's newer, and it's in a great neighborhood, there's bowling, movie, shopping, I mean, everything's right around it.
well, and we'll get that out. I had not heard anything negative until this time, but as soon as we'll check it out. So, thank you for telling us.
We'll make some deals with some other hotels, like I just got a thing from Emerald Suites, which is really nice.
I read some emails and it said it was
I know
great.
that's what we've heard
That's why I
that.
went
I've heard
there.
it at least a dozen times. It was wonderful. So,
That's why
Yeah,
it's hard for us
the
to
facility
recommend.
itself is great.
is that right?
The facility itself.
Yeah, the
but,
suite and everything was nice, and they're
Panhandlers,
accommodating.
staying in rooms.
But I think their government subsidized some people stay there.
We
No.
don't know what the situation
No.
is, but
But
it was a rough
Yeah, we
crowd.
just have a lot of, that's what we do some parts of town.
There's no, the government wouldn't subsidize anywhere staying in a hotel. They
Okay.
have,
Oh, that's
they
what they
actually
say.
have apartments for that.
All right. Now, David, were you staying very nice, or?
I'm staying very nice.
Where are you
Yes.
staying, in Green Valley?
Uh,
Where are you staying?
It's in Summerlin.
I'm
Oh,
in Summerlin.
oh, you are. JW.
How you doing?
Fine. How are
Good.
you?
Good. You're recovering okay?
I'm fine.
Good.
Yeah.
Did you weigh yourself yet?
Yes.
And?
I lost 7 pounds.
And how are you feeling?
Good right now. Yeah.
The pain of the drains is kind of a distant memory. I
We
hope.
don't want to talk about that. It was like a Charlie horse, wasn't it?
It's like Charlie the horse kicked you.
I don't want to hear that.
Yeah, you only have one to come out.
Yeah.
And actually, the later it's not. But it hurts. It hurts the drain coming
It
out.
does.
Yeah.
Okay.
Maybe you want to keep it.
No.
Any questions? Anything we ought to go over? Anything on your mind that's unanswered, or?
No, I did. I think I did very well because, like, just after they got me to my room, I was up walking the halls and everything, and I loved her right before surgery because we were sitting in here getting ready for surgery, and she's sitting here and she's just tapping her foot, and her daughter Elisa is sitting here, and Dr. Rutledge loves to talk, and so he's telling story after story after story, and she's just sitting here tapping her foot, and he goes, "What's the matter?" And her daughter chimes in, she goes, "She wants you to hush and let's go." And then Dr. Rutledge says, "I'll go when I'm ready." But that was probably one of my favorite moments of the whole thing.
Well, one of the things we do is we analyze our patient's assessment of us. So we have these 5 questions we ask you to grade me between 1 and 5. And we ask, for example, did Dr. Rutledge do a good job of explaining things? Did Dr. Rutledge show compassion? Was he available? Things like that. And one thing we ask that's graded between 1 and 5 is, did you have enough time with Dr. Rutledge? And we consistently get average on that. And that really annoys me because I'm almost 5 out of 5 in everything else.
Hello.
5 being the best.
Yeah.
Yeah.
I don't want any of you saying you don't have enough time with me. And if I catch you saying that, I'm not following. So I try and spend a lot of time until at least somebody says, okay, I've had enough. So.
Well, every time we called you, you got right on the phone the first time we called, and we had no problem getting access to it.
Okay, well, any other questions? David?
No, I think that for you guys who are getting ready to go through it, I think that my situation was different because I'm not morbidly obese, but my family history dictated that I was heading that way. I have a very severe case on my father's side. Every one of them are diabetic. They've died from diabetes, and I just finally got to the point where I said, I'm not going to end up like the rest of them. And so that's, Dr. Rutledge was very kind, dealt with my doctors, in North Carolina. He, got on the phone with them. He reviewed medical charts, everything, to make sure that, because my BMI didn't fall in the...
Yeah, you didn't meet the standard criteria that are kind of published from the NIH back in 1999. I think one of the advantages of meeting in this group, you can kind of see, as you look at the different people here, maybe what your future might hold. You've seen it kind of in your family, but also Ms. Zip is, kind of an older version of someone who, was maybe not quite so heavy when you were younger.
Right, I wasn't.
And so what happens as we age is all of us are going to lose capabilities as we get older. But obesity takes those things away from us more quickly, and sometimes in a very devastating way. So obesity in the United States is the #1 cause of acquired blindness. Okay? Well, I don't want to give up my sight. Heart attack, stroke, amputation, kidney failure. I mean, diabetes is a really critical illness, and as you point out, I think we assess every patient, and if you have that as a family history, and if you are kind of borderline, your weight was borderline, we do consider patients, and the woman who is sitting in front of you, I think those patients also are people that we at least consider for surgery, and we try and put you through a very rigorous pre-op process. We don't want to willy-nilly just say everybody can have the surgery.
Boy, did they.
Can I ask how much you had bypassed?
6 feet?
With the hope of losing how much weight?
Well, I was 250, I was either 254 or 257, I can't remember what it is.
257, I have to update.
Oh, okay. So I'm down to 248, we just weighed in
How tall are
today.
you?
I'm 6 foot.
Okay.
So, I'm 6 foot.
So let me ask you, if you bypass 6 feet on him, and the average weight loss on a 6 foot bypass, we're talking somewhere around 100 pounds?
No. The average weight loss for a 300-pound person with a 6 foot bypass is 140 pounds.
Okay.
Now, what we found is, and Trish is not here, but Trish had like a shorter bypass, and as you get to that 200 to 250 pound range, unless you bypass 6 feet, for most of our patients, they won't lose very much. So you need 6 feet. Now, you're an exception. I mean, in other words, we don't have many people, I mean, well, if you think about it, we don't have many people like you.
You don't have anybody else like
Well,
that.
that's right. So, I mean, you think about it, we kind of, at the time of your surgery, and when we revised your surgery, it looked like we had done what we do in everybody else, but it was just different for you. You got more weight loss for 6 feet than anybody else really has gotten from 6 feet.
Lucky me.
Well, or you think about it, if you look around this room, or you think about the people you know, we're all different. So,
Absolutely.
It's not as if, well, the analogy I use is, it's not like you're going to Home Depot. You say, I want a 4 foot 2x4, and you get a 4 foot 2x4. If you say, I want a 3 foot screen door, if you walk home, you can be pretty sure if you bought a 3 foot wide screen door, you're going to walk home with a 3 foot wide screen door. You got what we think is the usual kind of surgery, and a 6 foot bypass in most of our patients works pretty well. But some people lose too little, and a few lose too much.
Those people, oh, you want to finish with them first?
Yes. You know,
Well,
I know you
I
did.
would just like to say something. We had, on Wednesday, you had, what, 4 surgeries that day, and 2 of them went really bad. They went south real quick.
Yeah.
And it ended up being a working operation for me. So, But
We had one patient that when we opened her abdomen to look in, she had very advanced cirrhosis and what's called portal hypertension, which is when the veins swell up in the abdomen, and fluid in her abdomen, which is called ascites. So the surgery itself only took about 10 minutes, and we backed out immediately. And she flew home to North Carolina on Tuesday. And very scary, very serious illness. And again, that's a little bit of a measure of your future if you're heavy. Now, it's not a guarantee. You know, like sometimes if you smoke, you can get lung cancer. It's not a guarantee, but sometimes when you're heavy, you get fatty liver. If you get fatty liver, sometimes that advances to liver failure and cirrhosis. And Miss Kendrick, who was here with you, when we put the TV camera in, what we saw, instead of liver like you might see at the grocery store, was more like a gray sack of marbles because of all the scarring and damage. So we got out immediately. And so she's back home and with her family right now. So it was.
and they're very thankful for that. They're very.
Well, it's interesting. In all of her pre-op preparation, she had a cardiologist and a medical doctor and a lot of special testing. They never diagnosed the fact that she had this very severe liver disease. And now there is some hope with some treatment. First, they have to make sure it's not a virus, and there's a bunch of things to be done. But the hopes and prayers are that they might be able to reverse that. So. And then the other patient we had is the husband of a wife and daughter that we'd operated on from Kansas. And at the time of surgery, we operated for about an hour, and it was just densely filled with scar tissue, so we couldn't do his surgery. So 2 terrible complications.
Scar tissue from previous.
He had had 10 previous surgeries, including a perforated colon and an abscess. And so we thought there was a reasonable chance we couldn't do it, but he had bad diabetes. He'll actually be here a little bit later this morning to have his blood tested in preparation for going home. But it's really serious, and we kind of like Ms. Zip. We wanted to help with his diabetes, and he was really hopeful given the fact that his wife and daughter had gone through the surgery and done so well. But it was really disappointing because we couldn't get through the scar tissue.
You might want to explain to these people how important it is to listen to what the anesthesiologists are telling because of Nancy's problem.
Nancy?
She took the
She took the
Xanax.
Xanax.
the night
Oh,
before.
right. Yeah, another person. Yeah. We had another person who's a local attorney, and she couldn't wake up for a day. So in other words, we use very short-acting, very lightweight anesthesia. It lasts only about 30 minutes. So we finished her surgery and walked out, and a couple of hours later they called and said, you know, she's not waking up. And so we went back, and I kind of sat by the bedside for about 2 or 3 hours, and we sent off a bunch of blood tests and never really found anything wrong, except as we talked to her, she was kind of nervous the night before, and so she took a Xanax tablet. Well, if you're not sensitive, if you're not used to it, the Xanax can work for a full 24 hours, plus the other factors that she had taken, and so it took her about a day for that Xanax to wear off and for her to wake up from her anesthesia. But she was very relaxed for the surgery.
Take that Ambien tonight.
I would not take Ambien tonight.
I wouldn't even take it loud.
Yeah, that's right. I forgot about Nancy already.
But she's doing fine.
Yeah, in fact, she should be. She's, you know, she always comes late, so. Other questions for you?
No, any of you guys who are having it done, I think it's a great thing, especially if you're dealing with health risk and, you know, stuff like that. But I will tell you, you will never want to see another can of chicken noodle soup in your life.
I'm getting sick of it.
Okay.
You're getting tired of it.